Good afternoon, one all my seniors and my colleagues. I'll be talking on an easy rehab protocol of simulated weight bearing for the prevention of complex regional pain syndrome and deep vein thrombosis of the lower limb. So, complex regional pain syndrome and deep vein thrombosis are daunting tasks both for the patient as well as for us treating orthopedic surgeons. CRPS is basically a complex entity whose treatment is very prolonged, includes a very holistic approach. You have to counsel the patient from psychotherapy right to medication. So prevention is always better than cure in these cases. So for example, this patient was treated for a calcaneum fracture. He developed CRPS in the acute stage. You can see the right-sided foot is red, swollen, very painful, hypersensitive, and was weak. He could not walk properly. The X-ray changes are developed. You can see periarticular osteopenia from sheer disuse of the foot due to pain. Another case of 40-year-old female. She was in a cast for 3 weeks for a simple ankle sprain. She developed swelling, hypersensitivity, redness, and similar symptoms of CRPS. Now, CRPS is common in children as well. This boy had CRPS after being in a cast for 4 weeks. As you can see, his difficulty in walking, a swollen foot, and a deformity developing as well. So CRPS affects children, adults, aged, everyone. This girl was treated for an ankle sprain in a cast twice. She followed up with severe pain, redness, and edema and wasn't able to walk for a total of 8 months. So we came up with a protocol which is known as simulated weight bearing maneuver. The patient is made to sit in a supine or made to be in a supine or a sitting position with both the legs extended. A pillow or any firm surface is placed in front of the sole or the foot as shown in the next slide. The patient has to push or press the pillow forward and hold for a total of 5 to 10 counts. This can be repeated several times a day, very easy to teach the patient, has very good compliance as well. So this is the procedure. You just ask the patient to do a simple procedure as pressing down on a pillow or a firm substance or a firm surface. So you make use of the venous pump or the gastrosoleus complex in the foot. So the force of pressing the pillow must not exceed 10 kgs. It could be in the range of 6 to 10 kilos, which can be moderated. The patient can be sensitized and taught by putting a weighing scale at the end of the foot. So this just sensitizes the patient when he has to weight bear. So we also did another intervention and conducted a Doppler study to see the changes in the venous flow in the calf muscle when one does this procedure. As you can see from the baseline, the increase in venous flow in the calf increases to about 4 times normal when the patient is doing this procedure. Hence, it's a very efficient medical adjuvant to chemical treatment in deep vein thrombosis of the lower limb. So it's been used since 2016 for all immobilized patients, can be used in ankle sprains, can be used in post-op patients of trauma, can be used in all age groups. The only exceptions are a foot drop and neurodeficient. Along with this maneuver, medical treatment must also be given for the prophylaxis of DVT. And this can be continued till full weight bearing until it just helps the patient to sensitize and allows him to weight bear in a much easier sense. So this was also tried after a fusion surgery. The patient was told to press against the edge of the bed. After surgery, it can be started on the same day as well, and he gave us good results. So we've not reported any case of CRPS in the last 5 years. Venous Doppler study shows significant increase in blood flow in deep veins, which help prevent DVT. Also, medical treatment must be given. Limitation, no comparison was possible with people who did not follow the protocol. So simulated weight bearing is an easy and effective rehab protocol to prevent CRPS, and it is a helpful mechanical adjuvant along with medical treatment for the prevention of deep vein thrombosis. Thank you.